Hey, it's Christy from the Wellness Way in Sarasota, and I'm going to walk through the steps on how to complete a stool test. In your kit is a patient guide. This is going to outline instructions for you to complete your stool test. And on this front page here, I'm just going to quickly highlight a few things, but please read through it and make sure that you are planning your collection appropriately. If you've had a colonoscopy, please wait 4 weeks before collecting your stool test. If you have been on antibiotics, antifungals, antiparasitics, probiotics, PPIs, if you are taking a PPI, please wait 14 to 28 days before collecting your stool test. If you take aspirin, NSAIDs, laxatives, antacids, please try to avoid them 2 days prior to collecting your stool test. If you have an active hemorrhoid or you're on your menstrual cycle, please refrain from collecting your stool sample until after the bleeding has stopped. Again, you can find all of that here in your patient guide, so just please read through that as you plan to collect your stool sample. If you've gotten your kit from us here in the clinic or we've shipped one to you, I prefer that you get your kit and you unbox it right away so you can see all the contents that come in the box. As we unpack your box, you're going to notice a few things, which I'll review with you. First is your patient guide. These are your instructions on how to collect your specimen. I prefer that you read this when you go to collect the specimen so you can refresh your memory and know exactly how to collect each sample. This here is your activation code and stickers. These go on each of the samples. When you go to fill this out, you'll want to include your date of birth and the date you collected the specimen. Your kit does include a prepaid label through FedEx, so you're going to use this when you're done to ship everything out back to the company, and it's already prepaid. Here you'll start to see the different tubes and collection pieces of your kit that come in bags. You can unbag this here. So you'll notice that your bag does come with gloves, and there are 4 different collection tubes and a swab test. So you're going to collect the stool in this tray. If you prefer, you can order a toilet hat on Amazon. We can always send you a link for that, but those are disposable as well. If that's a little more easier for you to collect the sample using a toilet hat. If not, you can use this tray. Once you've collected your stool sample, you're going to start with the green top tube here. There is a liquid in it, but please just use the built-in scoop, and you're going to scoop 3 scoops of your sample into the tube. If it's a loose stool, you're going to do 6 scoops into this green tube. You're going to mix it in with the solution, and then you're going to put the cap back on, and you're going to shake for 30 seconds. This white tube will go next. There is no liquid in this tube, so please just fill the sample up to the red line that's on this tube and cap it. Your orange top and your pink top both have liquid in it. What you're going to do is you're going to use the built-in scoop, and you're going to scoop your sample into the tube here. Please be mindful that this liquid will rise. You do not want that liquid to go above the red line, so please just be mindful of that when you're collecting. You're going to mix it into the liquid here, and again, you're going to put the cap on and you're going to shake for 30 seconds. So you do that for these 2 here. Once all 4 of these tubes have been completed, you're going to do the swab last. So whatever's left in your tray of your sample, you're going to take this swab and you're going to swab in different areas of the sample that you've collected. You're then going to put it into this tube and you're going to swirl it around and mix it in really well for 60 seconds. Once you've done that, you're going to break the tip off. You'll see here that there's a little perforated line on the tip. You break it off and you actually leave the tip in this tube, put the cap on, and you're good to go. Once you've collected the sample in all 4 of the tubes and the swab, you're going to want to make sure that you include your activation sticker, and a sticker is going to go on each one of the tubes and the swab collection. Please make sure again that your patient date, your date of birth is on there and your date of collection is on there. Once that's done, all of your samples have your stickers on them. You're going to put them back into the biohazard bags. And then you're also going to put them back into the box, okay? So everything goes in a biohazard bag and goes back into your box for shipping. You'll then close the box up. So you're gonna put the box inside of the bag, and it is a prepaid FedEx label. So you wanna make sure you take it to a FedEx location that accepts this package. If you're local here in Sarasota, there is a place called PostNet in Bradenton off of State Road 70 and Lakewood Ranch Boulevard. and you're going to want to drop it off right after collection. Please do not hold on to your sample for a day or two. We want to make sure that it gets sent out right away so that Genova can receive your sample and start testing it. Again, if you have any questions, please reach out to our clinic. I'm here to answer any of the questions that you may have. You can give us a call or email us if you have any outstanding questions at this time.